Hey, you are watching AliAziz YouTube channel.
Top 21 Pharmacist Interview Questions for Fresh and Experienced Candidates. 1. What is the responsibility of a pharmacist? The responsibility of a pharmacist is to manage a drugstore, advising patients and physicians, verifying accuracy of prescription, reviewing possible side effects, assigning correct dosage, recommending most appropriate non-prescription drug. Give information to the patient about drug interaction. 2. What are the 3 qualities a professional pharmacist should have? Drug management, customer management, staff management. 3. What are the record-keeping procedures that a pharmacist have to do? The record-keeping procedures that a pharmacist have to do: storing pharmacy files, patient records, inventories, and update system files, registries of poisons and controlled drugs. 4. What are the side effects of methadone? The side effects of methadone are feeling anxious, nervous or restless, insomnia, sleeping disorder, feeling drowsy and weak, nausea, vomiting, diarrhea, constipation, loss of appetite, dry mouth, impotence. 5. Classify the controlled drug. What is the storage procedure for controlled drug? Controlled drug is classified into 5: Schedule Type 1, Schedule Type 2, Schedule Type 3, Schedule Type 4, and Schedule 5. For CD drug, it should be stored into a closed cabinet made up of metal and with a lock on it. Moreover, only authorized persons should have access to it, and only he can administer the CD drug to the patient. For home visit, doctors should carry in a lockable bag. 6. Is pharmacist allowed to give a copy of prescription? Yes, pharmacist is allowed to give a copy of prescription, but they can only use a copy of prescription for an informational purpose only. A pharmacist cannot dispense a drug from a copy of a prescription. They can contact your doctor to provide you with a new prescription in case you lost your prescription based on the information on the copy of prescription. 7. Explain why doctor prescribes antibiotics more for viral infection instead of antiviral drugs. Doctors prescribe antibiotics without any test because most infectious disease is caused by antibiotics, though antibiotics are less effective on viral infection. At the same time, it has fewer side effects and more spectrum compared to antiviral. Antiviral has a narrow spectrum, which means it is effective on limited virus. In serious condition, only antiviral is prescribed. 8. What are the errors that a pharmacist should avoid while dispensing drug? Patient's wrong information, age, weight, allergies, pregnancy status, etc. Inaccurate drug information, miscommunication between health professionals, staff and patient, wrong drug labeling, packaging and nomenclature, look-alike drug or package, inadequate education given to staff related to drugs, inappropriate way of storage, standardization and distribution of drugs, ignoring quality processes and risk management, inappropriate way of medication delivery, device acquisition. 9. What are the problems you face being a pharmacist? Being unable to read prescription, administering controlled drug, and dealing with patient need to communicate with all type of people to see drug interaction with prescribed drugs. 10. What is warfarin and what are some of the drugs it interacts and should be avoided? Warfarin is a drug used as anticoagulant, and it is used in patient who is at high risk of heart attack due to blood clots. Some of the drugs with which it interacts and should be avoided in combination with aspirin, clopidogrel, daniproid, dipyridamole, LMWHs, NSAIDs, ticlopidine, unfractionated heparin. 11. What is NABPs? NABPs is the electronic licensure transfer program, allows licensed pharmacists to transfer their existing pharmacist license easily from one state to another. 12. What are the information should be there on a prescription for controlled drugs? For a controlled drug, prescription should cover all these information: date of issue, patient name and address, practitioner name, address and DA registration number, drug name, drug strength, dosage form, quantity prescribed, directions for use, number of refills, authorized manual signature of the prescriber. 13. Explain, can controlled substance prescription be refilled? Controlled substance prescription can be refilled for up to 5 times in 6 months. Schedule Type 5 can be refilled as directed by physician, while Type 2 cannot be refilled. 14. Is it permissible for controlled drug to dispense a prescription for a quantity less than the face amount? Yes. Partial refill of Schedules 3 and IV controlled substance prescriptions are accepted under federal regulations provided that partial filling is dispensed and recorded in the same manner as a refilling. The total quantity dispensed in all partial filling does not exceed the total quantity prescribed. No dispensing occurs after 6 months past the date of issue. 15. Explain how Pharmacist can help the patient with asthma. Pharmacist can help the patient with asthma by educating them and give information on it. Trigger management, role of controller medications, role of rescue medications, early detection of disease. 16. Explain what is peak flow meter. Peak flow meter is a cheap device used for assessing a patient's current asthma control. It helps patients to monitor the asthma level and its severity. It measures the peak expiratory flow (PEEF) rate. 17. Can pharmacies provide EC, emergency contraceptive, to women under 17 years old? Yes, pharmacies can dispense EC to women under 17 years old. It can be sold directly on store shelves without a prescription. 18. Explain how you process your prescription. Once the patient prescription is processed, we follow the following steps. Prescription drop-off. Once prescription is received, immediate communication begin with doctor and insurance company to make sure that we have the required authorization to dispense the medicine. Benefits investigation with specialty prescription. We take additional steps and information to understand the benefit and work with patient insurance plan and doctor to get him on therapy as soon as possible. Prescription pickup. If patient is waiting for a prescription to be authorized, we will call to schedule a pickup at a target that is convenient for the patient. 19. Explain what is NCPDP. NCPDP is a National Council for Prescription Drug Program. Before anything is started, a pharmacy needs to sign up with NCPDP, a database service which allows to bill. NCPDP issues a unique number to each pharmacy that identifies it for billing purposes. 28. What is PBM? PBM stands for Pharmacy Benefits Manager. It is often a third-party administrator of prescription drug programs, but sometimes can be a service inside of an integrated healthcare system. It is responsible for processing and paying prescription drugs. 21. Why pharmacist insurance is important? It is more often that in case of any critical situation, doctors are sued by patients, but there are still chances that even pharmacists can be dragged. So insurance can help you pay for your legal defense and can protect your license rights.